Hello, my name is Christy Terry from ExamSoft, and I'd like to welcome everyone to our webinar today entitled Using Rubrics to Implement Professional Behaviors Assessment and Guide Student Advisement, hosted by Dr. Sara Voorhees. Dr. Voorhees joined the University of Jamestown Physical Therapy program in 2013 as an assistant professor. She is a member of the program's assessment team and teaches the evidence-based practice courses. She has been a practicing physical therapist since 2003. Before we begin, I have just a few housekeeping items to go over. If you have specific questions, we encourage everyone to type them through the questions feature of the GoToWebinar control panel, which should be located on the right hand of your screen at any time. We will have a chance to answer all questions at the conclusion of the webinar. At the conclusion of the webinar, you should have a quick survey pop up, and we encourage everyone to fill out the short survey if at all possible so that we can continue to provide relevant content at all of our presentations. If you're interested in viewing past webinars or registering for upcoming webinars, you can view an entire list with descriptions at resources.examsoft.com. Just a quick reminder, registration is also open for the third annual ExamSoft Assessment Conference, also known as EAC, which will be held June 14th through 16th in Denver, Colorado. More information on the event, including session abstracts and the agenda, can be found at assessmentconference.com. Today's webinar is being recorded, and all attendees and registrants will receive a follow-up email with a link to the recording in the next couple of days. Please feel free to share it among your peers as you would like. And with that, I'm going to turn things over to Dr. Voorhees. Thank you so much for attending, and please enjoy this webinar.
Assistant Director of Assessment, and Mitch Wolden, who is Assistant Professor in the Physical Therapy program. So we're going to go through our process of using rubrics to kind of implement and use professional behaviors to help guide our student advisement. So the Physical Therapy program is located in Fargo, North Dakota, and we've been using ExamSoft for about 2 years now. The main campus is 90 miles to the west, and we're located here because of the size and the access to area clinics and hospitals. Our physical therapy program is integrated, so the students do their first clinical experience at the end of their first year, and then in their second year they have 2 clinicals, and then the last semester of their third year is a final 16-week clinical practicum. I am an assistant professor in the program. I've been here since the beginning, and I've been a PT since 2013. Anna is our assessment queen. She began with the PT program part-time and was instrumental in helping us prepare for accreditation. And then last summer, she became the assistant director of assessment for the university. Mitch Wolden is another one of our professors that has been with us since the beginning. And he is working on a PhD with an emphasis in institutional analysis, which is really, this is right up his line of work. So the objectives are really I'm going to go through what the professional behaviors are in the field of physical therapy and how we use the professional behaviors assessment. I'm going to go through how we track it in the rubrics by using the categories, and I'll go through some of the reporting that we use with the professional behaviors kind of across the curriculum, so you can see how UJPT uses the professional behaviors in our advisement process. This came about because we wanted to work with students in being a good, well-rounded student physical therapist and a good healthcare professional. And some of the students need more guidance than others. So what we were looking for was a way to measure these things that are kind of difficult to capture with just a test. And even things that we could see in a practical or a presentation, but we couldn't really measure it very well. So the rubric package from ExamSoft really helps with this. So for example, critical thinking skills, problem solving skills, or then just being a good professional. So having the good communication skills or interpersonal skills, or just being a good professional student. is what we were trying to improve with our students. So the professional behaviors in physical therapy were developed probably about 10 years ago at this point. So they're required elements in our program, but they aren't really tied to any coursework specifically. But what we do is that each student physical therapist, SPT, has a faculty advisor, and we meet each semester. The students set measurable and objective goals based on their professional behaviors, and they're things that they can be achieved either in the classroom or in the clinic. And goals can be suggested or set by a faculty advisor. So if we have a student that is chronically late to class or late in clinic, then we can make that a goal so that they have something professional that they can work on and to improve upon. So the professional behaviors, as defined by May et al., are a repertoire of professional behaviors that have been identified to be successful in the field of physical therapy practice. But these principles are things that can be applied across any discipline, really. The idea is that they facilitate student growth and development, both in the clinic and in the classroom. And like I said, it can be applied across disciplines. So the professional behaviors in the context of PT, so if we have students have life experiences before they come to us, but they don't have them as a student physical therapist. So that's the difference. So the students we consider the students to be kind of at a beginner level because as a physical therapist, they don't have we need to know that these professional skills are there. So the first year, the student PTs, the SPTs are beginners, and their goal is to be entry level by the time they graduate. So there's 10 separate elements that we've identified for student success in physical therapy. And like I said, at the beginning, when they're the first year of PT school, they're really at that beginner level. And most of the elements, the beginner level has been kind of defined primarily based on didactic education. And then as they move through intermediate onto entry level, it's primarily focused on their clinical skills. So I'll go through and just kind of touch on a little bit about what each of the professional behaviors are. So critical thinking, right? The ability to ask relevant questions, articulate ideas, recognize holes in their knowledge base, determine what information is important and what is not when looking at a patient, being able to analyze the literature, which is a little bit different than problem solving, which is the ability to kind of identify and recognize and prioritize problems, identify the factors that contribute to the problem, consult and know when to consult in order to clarify a problem, and able to figure out the solutions. Then there's communication, right, which includes verbal and nonverbal communication skills, being able to communicate well with varied audiences at the appropriate level. Interpersonal skills, being able to interact effectively with patients, families, colleagues, maintain a professional demeanor and demonstrate interest in their patients, establish a trust and respect. Professionalism includes abiding by the APTA, the American Physical Therapy Association Code of Ethics, project a professional image, identify professional mentors, represent the profession appropriately, remain within the scope of practice, things like that. Effective use of time and resources, right, is being able to manage their time, being prepared, determining how much time and assistance they'll need to do things. Stress management, their ability to identify their own stressors and seek assistance as needed. Also be able to see it in others and have outlets to cope with the stressors. Responsibility is just being accountable for actions, including being safe and secure with their patients, abiding by clinical and academic policies, and acting as a patient advocate when needed as well. These two professional behaviors, use of constructive feedback and commitment to learning, are things that we really still haven't quite been able to capture in an objective way with the rubrics. These are certainly things that happen within the physical therapy curriculum, but it tends to be outside the practical or the presentation or the test, like after they've gotten some feedback, how they modify from there. We don't really have a way to capture the change that goes on with that. So I'm not gonna, these haven't really been assessed well with our rubrics yet. So we realized when we were using the professional behaviors, we were really capturing the student perspective. We meet with the students and we have them fill out these forms where they identify where they believe they could benefit in improving on this professional behaviors, but the students set the goals. And when we meet with the students, the faculty may modify the goals, but sometimes they're a little bit easier than others. For example, stress management, they can simply say, I'm gonna work out 3 times a week. And that's great. But the faculty's perspective also needs to be considered, because we believe that helps identify some of these behaviors in a way that the student may not see or identify as readily. But at least now that we've done this with the rubrics, we can now say we have data to kind of support what we're saying, because you're consistently not doing well with your communication skills during a practical. We need to work on this before you get to clinic. Oops. Going back up. So basically, the slide I just skipped over, I can't make it go back. We have the professional behaviors, and we wanted to kind of put them in the curriculum, in the coursework somehow, so that the students have a much better understanding of the professional behaviors and why they're important. So it's not just something that they have to do and meet with every semester, because it's not tied to a class or points they're not really interested in. And we had students that were struggling and we knew it and we could see it, but we needed to be able to capture it and demonstrate to them that we knew it was a problem. And ExamSoft has actually really helped with this. So for the students, we can discuss with them when we go over the professional behaviors, and as well when we go over the rubrics for the practicals or the presentations that they do, that they're getting graded on these elements. So they're not just things where we do once a semester. It's something that we actually can measure and look at throughout the curriculum. So measuring the elements can be somewhat of a challenge, but we think we've got a good way to do it. We've found that some elements can be captured better than others, but this allows us to incorporate these professional behaviors and measure them across the curriculum. So some of these elements are similar to Bloom's taxonomy, and some are not. Some are part of our CAPD standards, which is our accreditation. And some of them are definitely measured when students are in clinical as well. So when the students are doing clinical experiences, there's a clinical performance instrument, a CPI, and some of the professional behaviors are within this CPI too. So, and then we can measure it during their education. Typically in our program, it's through the presentations and practical examinations. So by doing it this way, it's actually made it relatively easy. It's especially easy for the students to see how we're really using it throughout the curriculum. It's not just something that they have to do. And so the student buy-in has been really easy to do. With the faculty, we have to make it easy for them to use the rubrics. And then it helps us and it helps the students figure out what the problem areas on or where they score poorly on. So it's something maybe we can work on in the clinic and in the classroom. So I'm going to go through kind of entering the categories in ExamSoft and show you how we tag the categories in the rubric. I'm going to assume you already know how to make a rubric, but I'll go through and show you what the categories are and how we use that. So here's an example. This is a sample rubric. So at the end of the first year, we have a comprehensive practical just before the students go out on their first clinical experience. And so we give them really basic patient cases that kind of encompass everything they've learned during the first year, and they evaluate and treat a patient. And the patient is typically an upperclassman acting a part because the upperclassmen have some clinical experiences now. So this particular rubric is the portion of that comprehensive practical because that has 8 rubrics in it, but this one focuses on the professional behavior. So you can see for each row, it's defined, and then there's different categories that have been tagged to it within the professional behaviors. So this is just to give you an example. And one thing we have found when it comes to using a category is to make them as easy to find as possible. So you can see on here, I've put the professional behaviors at the highest level I could put them. So it's really easy for the users. The users are the faculty. So it's really easy for the users to find. So if I say faculty, I do mean users. So what I did, basically, whoops, I did it again. I hit create new category, and then I select a destination, and you get a pop-up, and I named it professional behaviors. And I put it as high on the tree as I could, which you can see. Then when you hit select destination, you get this pop-up that you see right here. And I put it in a place that was easy to find. Then under the professional behaviors, parent category, this is where I added the subcategories. And I basically hit create and add another until I entered them all. And the reason they're numbered, like you can see it says critical thinking 01, 02 communication. It just that way they stayed in a standardized order for us, which is consistent with the professional behaviors documentation that we use. So then they're all entered and they look like this. And so the next thing that we have to do is give the faculty or the users access to it. And so by doing that, you hit the little key icon, the little yellow thing, and then you can see you can give the faculty access. And you can also do this under the administrator tab if you're an administrator. So I can highlight the professional behaviors and choose my user and choose my permissions, and then I can share the category with that user. I'm the administrator. I only give read access category rights. I don't want my faculty to be making their own categories. This way we keep things standardized across the curriculum, and so that things are only in one place. Also, just so you know, up at the top, if you're the administrator, you can manage the user settings and give category rights that way as well. And this is actually how I did it when I set it up, but there's different ways you can do this. So then adding the categories, or tagging as I call it, tagging the categories is easy to do, but it's also a very easy step to skip. And this is where this is actually where I spend a lot of time asking faculty to do it. And I do have to remind people repeatedly. And really, to get some of this up and rolling, I did go back in and tag some things myself just so I could go back and look at data or go back and look at people I knew were kind of the problem people. And so this is the rubric from our comprehensive practical, just to show you. This is the one that only contains the professional behaviors, which I believe I showed you previously, but then this is another practical on a completely different topic, just a basic bed mobility transfer topic. And as you can see, the first three elements include the professional behaviors, but the rest of the practical, while it includes them, also is more about their ability to do the task. And so to add a category to these rubrics, you simply click the category button under each row for each element. So if you click that button, this is what you get. Anything that's green, you can add to the list. If you click it, it moves over to the right-hand column. If you want to take it out, you can click the red button to remove it. For example, if you add things twice. So it's very easy to do. And then you hit done. So the hardest part, as I said, so far has actually been getting the faculty to tag their rubrics. I've tried teaching in stages. So when we first started with ExamSoft, we did questions and the written exam type things first, and then we added the rubrics, and then this is when we added the categories. I wonder if we should have done it all at once, but I have a feeling it still would be a little bit difficult to get everyone to tag the categories. Most of them do it. There's a couple that don't, but for the most part, we've managed to get it all work. And now that they're starting to see the process, like when I get to the reports, I'll show you. But now that they can see that we can see how we can measure how students are doing, it's made it a little bit easier because now the faculty are starting to understand the full scope of what we're trying to do here.
I'm sorry, Sarah.
Yes.
We're having a little trouble hearing you. So if you could
Okay.
just make sure you stay a little bit closer to the mic.
Okay.
Thank you.
All right, we'll try. All right, so then when it comes to the reports, we have the data, and the students have taken their practicals or they've given their presentations. We can go through and analyze the data. So the threshold that we've chosen for how well a student is doing is lower than 84%, which in our program, in 84 is the bottom threshold for a B. So that's what we decided as our threshold. It was somewhat arbitrary, but that's where we're starting for now. When it comes to the professional behavior, this is where we start. So I go into the reports and I do a longitudinal analysis. The first filter is for the dates, which I usually don't change, honestly, but you can specify the dates to be certain years or semesters. You can also specify certain users or the certain faculty. And you can specify the certain courses. I usually don't. I usually keep this one as it defaults to because I'm going to filter it with the second and third filters. So typically, for the pull down for the users, you can make it specific to the faculty. So if you want to look at certain faculty, you can do that. I usually have this menu drop down and select all users. For courses, for this example, I've selected all the courses, but you can limit it in any way that you see fit, depending on what you want to look at and what students you want to look at. For the secondary filters, for the assessment types, I actually leave it at all assessment types because we've discovered that even though you give a practical or a presentation, if you don't identify the presentation, if you don't identify the type of the exam or the type of the rubric as a presentation or a practical, the default is exam. So I actually leave it at all assessment types because it's going to capture anybody that misidentified or didn't change that default when they created the rubric and created the assessment, that is. In the secondary, so I leave assessment type for all types. For the assessments themselves, you can choose. Typically, when I do this, I run the reports by cohort, so it's simpler for me to just select all assessments because I'm going to sort out what I want in the third filter. And then finally, under the secondary filter, to include the rubric. So this, as I understand it, includes categories with 3 or more assigned items that allow you to limit to the categories that are actually used. So if it's only been assigned once or twice, it may not be worth analyzing yet, and it's not going to show up, and you're not going to have enough data. And then this third filter, this is where I tend to look at students by cohort. So I'll look at them by their class. And so that's where I narrow down. That's what I'm really interested in. So that's where I narrow it down. And then you also do have to select the categories. So when you're selecting categories, you can you select your categories and you can choose the ones that you want to look at. So for this example, I'm just going to show you what we did for just the professional behaviors. If it's not on the list of categories here, it probably hasn't been assigned to a rubric anywhere. And here you can select the exam taker group. And so once I've selected the cohort of the class of 2017, if I want to look at specific exam takers, I can. I usually don't. I usually look at the whole cohort because I found that if I pluck out, if I want to look at one student who's a problem child, and I just pick that student, it gives you, I'll show you on later screens, it gives you some mean information and then it gives you the single student that you're interested in. But if you don't select all the students, you don't have, your mean is only representative of who you select. So I tend to select all the exam takers. And then now that I've gone through all of these filters, I run the report. You do get a pop-up that it takes a few minutes to run, but in my experience, it usually takes a minute or so. So this is the output. And you can see, you can sort the blue bar at the top that says student ID, name, etc. You can sort by those numbers. It does give you the number of assessments and how many items for each of those and a group average. So that way you can kind of go through and see all the categories and how things are adding up and how your students are doing. So then if we kind of blow this up, I know this is hard to see, but you can see if you look at the critical thinking one, where I said that 84 was our threshold, you can actually see that there's a lot of students that aren't doing as well in this category. So this is a cohort of students after 1 year of data. So critical thinking tends to develop as they go on through the curriculum, so they aren't as good at it. But what concerns me is the student in the horizontal red bar, because he has several items that are lower than that 84%. So this is a student that I'm going to look at more closely and figure out what's going to be a struggle for this student in clinic or in the classroom. So if we look at another example, here's another student that was struggling with even lower marks across all the professional behaviors. This is a solid B student with most of the didactic coursework, but really struggles with communications and professional behavior elements. And so with both of these examples, we knew from watching the student in the lab experience it in the lab and during practical experiences that they were having difficulty. But now we've got it kind of measured and documented that they're struggling with these areas. And so that's really helpful for us to kind of pinpoint where some of the problems are. So the other thing I do is I've run the report again here, but this time I included the Bloom's taxonomy elements. So we can see really that the student does struggle with a lot of things, not just the professional behaviors, but some of the basic elements. And the Bloom's taxonomy ones are the ones to the far right, C1 knowledge, C2 comprehension. That's just how we've tagged those categories so we can find each of those things. But you can see that they're struggling in all areas. So I've said before, the process with the students, now that they understand it and they can see it in ExamSoft and they see it in the grading criteria, has really made it easy for them to buy into the process of using the professional behaviors, not just as meetings with the faculty advisors, but meetings with, but across the curriculum with the rubrics. So as I said, it makes sense to them now. So the buy-in has really helped. So then when it comes to advisement for the students that were struggling professionally, we knew it, but this gave us objective data that we could sit down with the student and say, look, you've been struggling with these things. So we want to have some goals where, we need to create an action plan where you're going to work on X, Y, and Z to work on improving these areas in clinic. And now it gave us something that we could directly measure. And again, just with the advisement, it reminds the students that they're being measured on these elements. So we're considering the student as a whole, making them a well-rounded professional. So not just that they're doing well in the classroom, but we're setting them up to be good professionals. And so having this ability to use these rubrics to make these goals and find the problem areas in the classroom before they get to clinic has really been helpful, because we have run into instances where not all the students recognize that what they're doing is inappropriate in the professional world, because they've been students for most of their lives. So with the problem students that we've had, we can review some of their deficits. And while, of course, the student has created goals because we've asked them to, but we, the faculty advisor, will create goals or have them create goals that can work on, especially, with the early clinicals, and can just be things like being professional, being on time, working on the basic communication skills. And then with the higher level elements like critical thinking and problem solving, do we need to get into suggesting a tutor for this student? Do we need to go over what their study habits are? How are they trying to learn this material? So there's other ways we can try to tackle the problem to help this student out if needed. Some of the changes happen naturally as the students go through and sort of figure out how to put the pieces of the puzzle together as they become entry-level clinicians. The critical thinking tends to improve. The problem solving skills tend to improve as they go through the curriculum, but it's still something, it definitely is an area that starts out kind of as a difficult area. But I guess the most important part, as I've said, is that this gives us data that we can show the students, and it gives us the data to support the discussions with the students. We see these things and now we can measure them in a way that makes sense. So to go back to the student perspective, the students that I've advised, really, they appreciate that the professional behaviors aren't just something that we have to sit down and meet with them about every semester. They realize how this ties into creating a good professional, well-rounded student, and or a good professional, well-rounded entry-level clinician when they graduate, and they see that now. And the faculty have come to understand that professional behaviors aren't just something where they have to meet with the students every semester, but how all of these elements tie together, and that we can actually measure. We've got a problem student, we can identify what's wrong and we can measure it. That gives us a way to help us fix it if we can, and to work with the students. So the rubrics package has been really helpful because it gives us the objective measures for these professional behavior elements, because you can't really measure them in the written exam. And when you're just doing a practical on a piece of paper, it doesn't have a way to kind of quantify it or to track it across all the students. It's just not the same. So having the information has really been helpful to use with guiding student advisement or guiding student learning if needed. So it's been really helpful. And that's really the bulk of it. So if you have questions, or if you couldn't hear something or you missed a slide, then you can certainly feel free to email me or contact me. And that's how you get a hold of me. And these are some of the references I used. Do I have any questions? Thank you very much.
Thank you so much, Sarah. That was a wonderful presentation. We have a few questions here, and they're coming in. So if you all have any questions, please feel free again to type them into the questions field in the right-hand side of your screen there. And we'll go ahead and get started here. Our first question is, how does faculty go about measuring something like stress level via rubrics? What exactly is the criteria that you use to measure something subjective like that?
Well, the stress one, because one of the elements is time management. So one of the elements is the time management. So that's really the best. We can't measure it. We can't see what the student is thinking or what they're doing. And that's one of the ones that isn't really well measured. We can see that they're struggling, or we can see that their hands are shaking, and whether it's a problem or not, whether it's interfering with their ability to do the task is really all we can assess. And that's not a good answer, but that's the best thing. That's the best we can do with it.
Got it. How often are rubrics used with students beyond the annual practice exams?
Well, we have, so the comprehensive practical is at the end of the first year, but leading up to that, so in the fall of their first year, they have 4 classes. At least 3 of those classes have at least 3 practicals. In the spring of their first year, again, at least 2 of those classes have at least 2 or 3 practicals, plus presentations. So within their first year, for us anyway, they're getting measured on probably about 10 different assessments that can measure these criteria. It's not just one at the end. That was just one example that I showed you.
Thank you. Who puts the scores into these rubrics after a presentation or practical examination? Do all faculty have a few students to assess?
Well, so for each of the individual classes that the students have, whoever the faculty is that's grading the student, they're usually entering. We sit with our laptops during the practicals and enter the information and comments right into ExamSoft as the student is taking the practical. We don't do it on paper and enter it later. The same thing for the comprehensive practical. It's a little, the faculty are assigned students to grade, or the students are assigned faculty that's going to test them. But then the rubrics are set up in such a way that you can assign who's going to grade who. And then the main thing there is consistency with the faculty. So the rubric has to be detailed enough that the faculty are going to be relatively consistent with each other. And I, like for the comprehensive practical, I grade that one. So I go back through and look at everyone's scores and make sure that people are generally consistent. And I can really only do that based on the scores and based on the notes they leave me about what the student is doing.
In a range, like what is the difference prior to using ExamSoft for rubrics with releasing grades to students for their practicals?
Say that again?
I believe the question is looking for the efficiency with releasing grades to students. Is it an instant process or is it over time?
Before I release my rubric grade assessment grades to the students, I usually go through and make sure that things are consistent and things have been graded in a standard way. Sometimes the first student I grade, I might do things a little bit differently. So I never release them immediately because I want to go back through and double check. But when once I hit that release button, I believe it's instant.
Great. And we have one final question here. How do you go about making the rubrics easy for faculty? Do you have training sessions for them?
Yes.
Okay.
I do go through the rubric with the faculty. I've gone through sessions with how to create the rubrics and how to use them. And then for each, and then if I didn't, then if for example, the comprehensive practical, I go through the rubrics with the faculty so they know what's in each of the elements before they actually do the test. But at this point, most of the faculty have created their own rubrics for each of their own courses. But yes, I did do training sessions with everyone.
Fabulous. Those are all of the questions that we received. If you all have any other questions or questions come up afterwards, I know sometimes you get busy and a question pops up in the middle of the day. So if that occurs, feel free to contact Dr. Voorhees at her contact information, which she shared earlier, or send an email to us here at ExamSoft and we'll get in contact with her for you. Once again, this webinar has been recorded and you'll receive an email with a link to the recording in a couple of days. So be on the lookout for that. Thank you for spending your afternoon with us this evening, and we'll see you on our next webinar. Thank you, Sara.
Thank you. All right, thank you. Oops.